I'm not really certain of the benefit of going after people who cannot pay for hospital bills and penalizing them for daring to get sick.
Medical debt is one of the leading causes of bankruptcy in the United States, and it's an issue Amelia Coley sees every week, including here in central New York. She's the debt program director at the Volunteer Lawyers Project of CNY. Many of her clients are being hit with lawsuits regarding medical debt, some wrongfully.
It's become clear that certain areas of New York, including central New York, are the really big hotspots, and that it is a burden especially on communities of color and lower income communities that are being targeted for these bills. They have even less resources to pay.
The Newhouse Spotlight team sorted through lawsuits filed by the state of New York, money owed to SUNY Upstate Medical University for medical services in the last 4 years. As you can see right here, the highest point of the graph, that represents people with lower income in Syracuse who are getting hit with hundreds of more lawsuits than those with high incomes. And take this graphic. This shows the number of summons issued by the state for medical debt with Upstate has tripled since 2021. We've reached out to Upstate for a comment twice and received no response.
The patient usually does not have representation. They usually don't even answer, or they don't know how to answer, which results in the hospital getting what's called a default judgment.
And part of the problem is also the fact that some of these indigent patients are eligible for charity care, but don't even know they're eligible. Or that there are people who earn a little too much to qualify, but yet are struggling financially to stay afloat. The Community Service Society of New York has run the numbers, and they say Upstate made $1.5 billion in 2021. Now, if Upstate collected on all the judgments from 2019 and 2021 combined, they would have only made $17 million, which is just a drop in the bucket. Donna C. Cartel was one drop to them, but to her, hospitals were taking everything she had.
Yes, I had savings, but it went really fast. And once you get sick, it seems to me that, like, even if you have like a year reprieve or more, that there's more down the pike.
C. Cartel was diagnosed with breast cancer in 2007. She says she's been sued by Upstate and other hospitals for thousands in the past. She's just above Charity Care's income cutoff by $100.
Literally shut down and not be able to do anything when I got a bill like that, and like the judgments and stuff, shut down, not do anything, like for 2 or 3 days. It would take me 2 or 3 days to get back to even doing the things I like to do and could afford to do at the time.
American Cancer Society research shows that medical debt isn't just a financial headache. It can actually mess with your health because of all the stress it brings. C. Cartel stresses out just walking to her mailbox.
I'm like putting it in the box or putting it in the, plastic bag or whatever I have with me from the mailbox, literally, and going, it's going to sit here because I can't do anything with that right now.
Like many people just are not, being properly informed of their rights as patients. And so I think that goes back to the accountability that we're talking about from our healthcare system.
Ursula Rozum is somebody who is spearheading the issue. She is the healthcare advocate who fights policy issues at the state level. She believes that hospitals aren't doing their job telling patients their rights.
They'll say that they were not informed. And I mean, I believe them because, why would you want to put yourself in the position to be pursued by debt collectors if you could avoid it?
Just this week, she helped pass a bill in Albany that removes the asset test that requires people to prove that they are poor enough to qualify for assistance. And lawsuits aren't just solo gigs. They drag the whole family into the drama. Gail Davis's son, Darius, was stabbed and had to undergo multiple surgeries.
That's my Darius.
He couldn't find a time to sit down with us, but we know from his mom it happened over a decade ago. And while he's all good physically, the financial scars from the $16,000 lawsuit are still fresh.
What in the world is going on? It seemed totally horrendous, unfair. My child, even though he was grown, had been assaulted, required surgery, was hospitalized, and then to be hit with an enormous medical bill.
Darius is stuck in that financial limbo. He earns too much for assistance, yet falls short of paying the $16,000.
Even credit card companies, are willing to work with people. They discount things and whatnot. But for New York to come after its own people who are caught between a rock and a hard place, it's anathema to me.
I'm Peyton Spellacy for the Newhouse Spotlight Team.